Our regular segment with my co-host of Coronacast, Tegan Taylor, whose day job is actually as a health reporter in the ABC Science Unit. Hi, Tegan.
Hi, Norman.
And you've been looking at how a pandemic ends.
That's right. And so obviously I'm single-handedly trying to solve how this pandemic that we're living through now will end. But while I was doing some investigating, I came across a really interesting footnote in Australia's medical history.
Mm-hmm.
So we were talking about, the pandemic that people love to compare COVID-19 to is the 1918 flu pandemic, which lots of people call the Spanish flu for reasons that I won't get into. Didn't start in Spain.
Yeah, nothing to do with Spain, yeah.
Yeah, that's right. But one of the things that we're hoping for with this pandemic is a vaccine. And it's often talked about that the 1918 pandemic had no vaccine. And it's kind of true, but it's also kind of not true. There were attempts to make a vaccine for the 1918 flu, including a couple here in Australia.
And so just tell me more.
So basically, it was a very high-tech method of getting people to cough up gunk out of their lungs if they had pneumonia, and then taking the bacteria from that and killing it, and then injecting that into people as an attempt to vaccinate them against it. Because, of course, in 1918, while the process of vaccines was really, it was a really hot time for vaccines.
But they didn't know anything about viruses.
Exactly. They didn't know viruses existed. They didn't know that the influenzas were caused by viruses. But when they looked in the lung gunk of people who had flu, they often saw bacteria there and thought that maybe that's what was causing it. And of course, lots of people did die from the Spanish flu from secondary bacterial infections. So, I mean, maybe it might have
could have been
some
virus in the flu, in the gunk as well.
That's right. But another really interesting thing about this particular attempt, there were more than one attempt being done all over the world, including here in Australia, but one of the groups that was involved in this was Commonwealth Serum Laboratories, which we might know today as CSL, aka one of the groups that's helping produce the vaccine, or helping speed the process of one of the vaccines here in Australia.
And in those days it was publicly owned, it was a government body, but then became privatised later on, which is the case now.
That's right. So it was based at a quarantine station, and it was basically developed during the First World War so that Australia didn't have to depend so much on imported vaccines. And in 1918, it was developing this first experimental vaccine because it knew that the Spanish flu was an issue. I don't think at that stage it had actually come to Australia. It was they were doing it kind of on the front foot. And the other thing that was fascinating to me about this was just the scale of this and the speed of this process. So obviously at the moment we're waiting patiently as the vaccines that are being attempted to be developed for COVID-19 go through multiple phases of clinical trials, as well they should. But in these days, they got a vaccine up within a month or two and millions of doses, and managed to voluntarily vaccinate a quarter of Sydney's population at the time. Yeah, a huge number of people. They lined up for it.
But of course, in phase 3 clinical trials to get registration.
That's right.
And we don't know whether it worked.
Well, we don't really know whether it worked. There was a study that they said it probably did reduce deaths in people who got pneumonia, but who knows what data they are actually using there.
So how did the 1918 pandemic end?
Well, yeah, so one of the things, pandemics start when you have basically a pathogen that can cause disease in humans and no one has immunity to, and it's highly transmissible. And so one of the things, the main way that they end in general is that we build up immunity to them. And so the 1918 flu pandemic, it infected a third of the world's population in about 3 years. So eventually we developed herd immunity to it, and it just became the seasonal flu strain. So people were still catching it, but it wasn't spreading at those huge pandemic levels. And it basically got kicked out by the Asian flu pandemic in 1958, and it spilt back into swine. So it spilled back into pigs, and actually the H1N1 pandemic of 2009, the swine flu pandemic, kind of in part has genetic material from that 1918 strain in it. Fascinating.
Question for you, Tegan. What was one of the first clinical trials ever recorded?
Oh, I don't know. Can you tell me?
Bloodletting in the 19th century. And it showed that it didn't make any difference at all, and it ended bloodletting.
That's so fascinating.
Now, we're going to start a new section.
That's right. It's time for me to ask you a question, one from our audience. So we're going to be answering questions each week in the podcast version of the show, which you can find wherever you get your podcasts. But you're listening to the radio right now, or if you are listening to the radio right now, we're going to answer a question for you now. So, Norman, David Gammy is asking, He's often heard that the patient should remember to mention various things to their medical practitioner when they go. And they're suggesting, is this something that could be searchable? For example, if David has an appointment coming up, could he search for his condition and refresh his ideas to plan for that consultation?
You could. It tends to drive a GP nuts, of course, when people come in with reams of material from the internet. And you should be able to, look, there's no problem in knowing as much as you can, as long as you go to reliable sources for that and not nutty sources. And you tend to know where they are, sort of reliable clinics, Mayo Clinic and what have you from overseas, WebMD, and there are other places that you can go for reliable information too. It's much more useful, I think, to have a set of questions, a kind of generic set of questions that you want to ask your doctor before you go in, when you go in, and they kind of work. So, for example, if your doctor wants to prescribe a treatment or start a treatment, or a specialist does, there are 3 questions which actually have been tested in a randomised trial at Sydney University. And the first question is, well, what's the chances it's going to work? And what are the chances of side effects? And what are the alternatives to this treatment? And what are the chances that they'll work and side effects? And this will really drive your doctor nuts, because they'll be forced back to the textbook. And the third question is probably the most important of all, is what if I do nothing? What will happen to me? And then if you're going to have a diagnosis, a diagnostic test, the first and most important question to ask is what's the chances that the result of this test will change my treatment? Because if it's not going to change treatment, there's probably not much point there. And what's the result that it could result in harm? In other words, unnecessary treatment. And in the podcast, I'll talk about some examples where you could actually get harm. And thirdly, again, what would happen if you do nothing? So, if you want to ask, we'll do more on the podcast for those who are not listening to the broadcast. And if you want to ask a question, go to healthreport_rn@abc.net.au. And we'll see you later, Tegan.
See you then.
This is RN's Health Report with me, Norman Swan.